One of our key goals for this Hill Day is to really help lawmakers understand the full breadth of occupational therapy and what it has to offer to the clients that we work with. This presentation is going to outline some of the focus of the current Congress and some of the problems that they're looking for a solution to. Your job is going to be to help show them how occupational therapy can be part of the solution. Whether a Democrat or a Republican, most in Congress have long thought that we need to fix our healthcare system. Currently, our outcomes are not matching our spending. The quality of healthcare we provide does not line up with how much we spend. So while many disagree about the Affordable Care Act, the desire to improve quality in healthcare and to get outcomes for the money that's spent is a bipartisan issue. A philosophy that predominates is an idea called the triple aim of healthcare. That healthcare that is provided, particularly if the federal government is paying for it, should meet this triple aim. The aim of care, improving patients' experience of care, health, improving the overall health care of populations so that the entire population of people is improved and better, and it's not just intervening when people come down with a chronic condition or an acute condition. And then the cost, that we need to reduce the per capita cost of healthcare. This triple aim is driving many congressional actions. So what are some of the current trends in what Congress is trying to focus on? Within the healthcare system reform, one is the transformation of primary care. The idea that we intervene not just when somebody comes to the office, but that we try to intervene in promoting health and wellness overall. The broadening of primary care also means that primary care isn't just relegated to someone, internal medicine or a nurse practitioner, but can be part of a broader team of care to help improve people's overall health. The next is care for chronic conditions. Caring for people with chronic conditions is one of the biggest drivers of health care in this country, and most in Congress think that we have not really tackled this issue of helping people with chronic conditions live the most healthy life as independently and happily as possible, and that we need to make sure that people with chronic conditions are fully participating in their own chosen activities, but also receiving the maximum care. As I mentioned with primary care, one of the focuses then is on health and wellness. If you're trying to improve overall population health, then you're also looking at preventative medicine and ways that people can stay as healthy as possible. And finally, as mentioned before, there's this focus on outcomes. If you're paying for an intervention, you want the best outcomes. So this relates to both evidence-based medicine as well as trying to use strategies that are going to reach the outcomes that you desire, so that are the most successful, and generally that's healthy people participating to the maximum extent possible. Mental health has also seen some new focus in Congress, as I'll discuss later. And with this, this fits with these new trends in that people are looking to provide quality mental health services that are doing more than just triaging people and keeping them as stable as possible, but helping people re-engage in the community and lead productive lives in activities that they choose. Another piece of this is a focus on integrated services, that we need to address not just mental health concerns for people with mental illness, but also physical health concerns. Congress's focus on long-term outcomes is not only in the area of healthcare. They're looking to increase overall independence and the long-term outcomes for people. So it's no longer just after 30 days after you leave an acute care hospital. It's the long-term outcome. How independent are you? Are you permanently reliant on government programs, or are you able to function as independently as possible? This philosophy goes across healthcare and mental health, as I already discussed, but the same with education. Are we helping people become their most independent selves within the education system, with our early intervention? Are we getting in, providing family-based, consumer-oriented services that are going to help that child along the best path? But it also extends to employment and the idea of supported employment and other disability policy. This administration has had a large focus on helping people with disabilities live and work as independently as possible in the community. And these fit the overall long-term goals of both Congress and the current administration. I like to say that what was old is new again. That we are at a time that is moving back to the philosophy of where occupational therapy started. People do want to live independently. They do want to help maximize people's participation, and that is seen as a desirable goal. This represents a fantastic opportunity for occupational therapy, but only if policymakers understand the unique contribution that occupational therapy can make, how we can be part of the solutions that they're seeking. I'd like you, during your visits, to make sure that people really understand occupational therapy. And then when making that definition, think about this philosophy. Think about the goal of policymakers. Not every office is going to be focused on this, but many will, and you never know who you're going to resonate with. Some ideas are included here. What can occupational therapy do to meet the goals of policymakers? We can help reduce hospital readmissions through falls prevention and training in self-care. We can help people maintain or regain independence through home modifications, adaptations, and teaching people ADLs and IADLs. We can identify the need for early intervention, helping screen children with developmental delays, help with the management of chronic conditions, help transition students from high school to employment and independent living. That's a role within the school systems that occupational therapy practitioners can really fill. They can be part of that transition team because more and more people are focusing not just on the academic, but on that student's ability to live independently once they're no longer eligible for those supports related to their education. And then also we can improve caregiver experience. Many in Congress are caregivers themselves. Caregivers are someone that they are very focused on, and we know that occupational therapy practitioners can help caregivers through training and through home modifications and give support for how to keep someone in the home. These are just some examples, but you should think when you're creating your definition, you should think through how OT can be part of the solution and helping create a more independent, quality-based services.